All right, what's up, guys? So, welcome back for episode 2. Last time we were talking about the upper cervical bony anatomy. Today, we're going to talk more about muscles. So, let's go ahead and take a look at the suboccipital muscle group. Spin around here and take a look at it. So, don't worry so much about the names of the individual muscles. Just think of it as a group. I'm going to kind of break it into two parts, though. So, you see kind of closer to the midline, this one here, that's coming off the C1 vertebrae, and it's coming up and attaching onto our skull. And then the next one that's a little bit wider like that, that's coming off C2 and then also up onto the skull. So when when this portion of the suboccipital muscle group is tight, it's really going to limit that nod. Remember last time we were talking about all the freedom of movement that we have at the C01 joint as far as flexion extension. Well, if those suboccipitals are tight, they're going to take that upper cervical flexion, that nod, away from you. Now, why might those be tight? Well, just take the average person that has to work at a desk all day, looking at their computer screen. Your eyes get tired. You're going to drift closer and closer to that screen. And to keep your eyes up, you'll kind of kick your head up like that. That puts those suboccipitals in a shortened position, and then they get tight, and it gets that much harder to get up into good posture. They're not going to let you get there. And we'll circle back to that idea here in a minute. Now, the oblique, I know I said don't worry too much about the names, but the oblique suboccipitals, they come out and attach, and we can talk about how to find the C1. So they both attach on what's called the transverse process of C1. The inferior oblique's coming off C2, and the superior is coming up in to attach to our skull. So those guys are going to limit rotation. And if you remember also from last week, we were talking about how much rotation we get from 1-2, so a segment or a joint lower. Those are going to be your limiters there. Now, if you come, there's kind of a knot behind our ear right there. That's called the mastoid. That's part of your skull. If you come down a little bit, that is the transverse process of C1. Okay. And then if you bring your hand around, kind of find the base of your skull, slowly come down. You got to be right in the middle. The first bone you feel is actually C2, not C1. C1 doesn't jut out. It doesn't have a spinous process on it the way the rest of the vertebrae do. So the first one you'll find is C2. Now you've got good landmarks for where these suboccipitals are, and that can come in handy when we get to episode 4 that's going to be about self-treatment and exercise. Okay, so let's look at one other muscle here on the back before we spin around to the front, and that is the famous levator scapula, maybe famous only to me. Creates a lot of problems, shoulder and neck. So you can see it does attach here on the superior angle of the shoulder blade, but then look at where the other end goes. And the muscle belly kind of breaks into these 4 kind of strings, and that's because it attaches to C1, 2, 3, 4. Okay, so relevant to those upper cervical segments, the 1 and 2. And this, we're getting into kind of a chicken and egg thing. Like, does somebody have rotator cuff weakness and levator tightened up, and because the levator was tight, they started to lose motion at C1 or 2? Maybe, or it could come the other way. It could start from up here because of the guy looking at his computer screen, and the suboccipitals are getting tight, and then that kind of becomes not an irritant, but it causes the levator to tone up as well. Okay. We'll kind of leave it there. There's way more I could say, but we'll leave it there. Let's spin around to the front now. So if you hear anyone talk about the deep neck flexors, these are the muscles they're talking about. So I am going to say the names of these. Don't worry about it too much. Just think deep neck flexors. So the first one here is called the longus capitis, and I was having a little trouble with my visual aid there, but I think you can still see where it is and where it attaches. And the most important part of this one is that it comes up, and that's actually like the base, kind of the anterior part of our skull. So thinking about that nod we were talking about, that's the muscle that gets it to you appropriately. So if the suboccipitals are tight, they're going to inhibit the longus capitis's ability to bring you into upper cervical flexion, which really good posture. It keeps so many things lined up the way they're supposed to be beyond just muscles and joints. I'll leave that there. So longus capitis, segmental stabilizer on the front of our neck attached to the skull. Longus colli doesn't go up as high, but nonetheless, they work together to maintain that posture. So those are your chin tuck muscles. But I think now we can start to see how all this stuff really fits together, and we've got some great base knowledge for now. Next week, we're going to talk a little bit about nerves, not a lot about arteries and veins. I'll have the images so that you can see where they are, but we'll talk about a couple nerves. And then episode 4 is going to be maybe what's most interesting to everybody, and that's what can you do about this stuff. All right, so stay tuned, guys.